Thousands of Queensland health workers who refuse to get the vaccine have been suspended. Georgia Simpson is live with me from the Gold Coast. Georgia, the sector's COVID vaccine mandate comes into effect today, doesn't it?
Good afternoon to you, Kieran, and that's exactly right. There's still 1 in 10 Queensland health workers who are yet to get vaccinated. Health Minister Yvette D'Ath said about 4,000 healthcare workers across Queensland would be issued with a show cause notice from today, and that they'd be suspended with full pay. She did acknowledge that there would be some disruption to the workforce, but they'd be able to manage that quite effectively as they've been planning for this for several weeks. She also pointed out that there were about 108,000 staff employed by Queensland Health right across the state. So although there would be some disruptions, they would be quite minimal. Overall in Queensland today, 77.8% of Queenslanders over the age of 16 have had their first dose, while 64.1% of Queenslanders are now fully vaccinated. Interestingly, Kieran, our Health Minister Yvette D'Ath was also questioned about interstate and international travel today. She was asked 3 separate times to explain the science behind scrapping quarantine requirements for fully vaccinated travellers arriving into Queensland from a hotspot, provided they test negative to COVID, but not providing the same sort of measures for people trying to come home from overseas. She eventually conceded that she was concerned there could be other variants overseas that could be brought into Queensland, and she was going to be following the health advice.
What's the science to differentiate between COVID-ravaged states and COVID-ravaged countries?
Well, because there could be other variants that are brought in, you have to look at the different vaccines and the efficacy of those. There's a whole lot of reasons. We go off the health advice. This is the health advice that we've received, and we support that health advice. We think it's reasonable and sensible.
And Georgia, Dr. Jeanette Young, less than 1 hour away from her official swearing in as the next governor of the state.
Yeah, that's right. Dr. Jeanette Young will be sworn in about 20 minutes' time at Queensland Parliament, 2 p.m. Queensland time for people watching along at home. She said that some of her greatest achievements during her 16-year posting as the state's Chief Health Officer would be getting Queensland's child vaccination rates up to almost 95%, as well as decreasing smoking rates statewide. Of course, she's also been very proud of the pandemic response, the way she's responded to the pandemic. Our Deputy Premier Stephen Miles has thanked outgoing Governor Paul D'Ath this morning.
Governor D'Ath was a constant of the Palaszczuk government, and I certainly found it a great honour to get to know him and Kay a little bit over our time in government. Of course, we all know Dr. Jeanette Young very well. She's been an excellent Chief Health Officer. She will make a fantastic governor, and in another piece of history making, for the first time Queensland has a woman Premier, Governor and Chief Justice of the Supreme Court.
Now, Mr D'Ath was farewelled at Government House today, and he became quite teary during his farewell speech. Here's a snippet of which he thanks his wife of 50 years, Kay.
It has been an enormous honour to serve the people of Queensland as Governor with Kay's abiding support.
While it's exciting for Mr D'Ath and the next chapter of his life, and of course for Dr Young as she embarks on this new role, there isn't a Chief Health Officer currently in Queensland. Authorities are left scrambling trying to fill that position after late last week Dr Crispin Hajkovic announced he wouldn't be taking up the post from today. He cited personal reasons and did ask for privacy during this time. Deputy Chief Health Officer Peter Aiken is stepping into the role for now, but there certainly is a task ahead for Queensland Health and authorities to try and fill that role. Kieran.